um, webinar that we're hosting together with our colleagues at UNICEF on COVID-19 in schools. Today, with me from WHO, I have Shalini Desai. Shalini's she's in the room here with me, but distanced. Shalini is a pediatric infectious disease physician by training, working at WHO in the immunization, vaccines, and biologicals group, but currently working on the COVID-19 response. I also have with me Ioana Giga, who has actually a background in pharmacy, but a career in public health, has worked for a number of years in the preparedness division of the World Health Organization, and also currently working on the COVID-19 response. I also have Rosamond Lewis, who many of you know from a number of our webinars. Rosamond has a long career in public health. Is also a physician and family doctor. And Rosamond is working in the science translation part of the COVID response. I'd also like to welcome Lisa Bender, a colleague from UNICEF in New York headquarters. Lisa is an education in emergencies lead, has a background in education, humanitarian response, post-crisis transition, and social programming for children and youth. Lisa, really a pleasure to have you on the webinar again. And we are very delighted to welcome somebody from just down the road here, Julian Schechter, who is a former journalist, editor-in-chief and producer. He has worked for a regional TV channel on the Swiss National Radio for 15 years before joining the State Department of Youth, Education and Culture as a communication manager and spokesperson. Julian is also a lecturer at the Freiburg University Faculty of Management, Economics and Social Sciences. So welcome, Julian. We're first going to start with a short update from my colleagues here at WHO. We've recently released some guidance which they will be speaking to, and this is on the public health and social measures in school. We will then pass over to Lisa, who will give us the perspective from UNICEF and share some stories and updates about current implementation practices in some parts of the world. And then Julien will be able to share with us some experience from Switzerland as well. So without further ado, Shalini, I think you are up first. So if you have joined by your computer, you should be able to see my screen. I'm going to share the presentation now. Over to you, Shalini.
Thanks very much, Sarah. I really appreciate it. I'm going to start off discussing public health and social measures in schools, and then I'll be handing over to my colleague Ioana to talk about a document that WHO has produced. Next slide, please. So when we started off with looking at this area, the first thing we were interested in learning more about was the epidemiology of COVID in children. And what I have here is a pie diagram of the epidemiology based on case reports received by WHO as of May 4th, 2020. I hope what you can see here is that while we've received many, many case reports, a small percentage of them, under 3%, are in individuals less than 18 years of age. This shows us a few things. The first thing it shows is that children can get infected, but it seems that the majority of children have mild disease. More severe disease is possible with COVID-19, but this seems to be a rare event in children. Next slide, please. So then we started looking at transmission in school settings, and as certainly occurred here in Switzerland, many countries have closed schools, and this is based on evidence and assumptions from influenza outbreaks. And essentially, the way that the thinking goes there is that we reduce the number of social contacts between students, and that allows for interruption of transmission of influenza. The role of children in the transmission of COVID-19 is unclear. There's a number of studies, well, there's a few studies involving educational institutions and COVID. Unfortunately, there's not a lot, but what they do show is that there's little transmission in school settings, and the transmission that does occur seems to be related to social events linked to school or university life, rather than transmission within classrooms. Next slide, please. We then thought a little bit more broadly about the benefits of reopening schools if that's feasible. And I think Lisa's going to be talking about this some more. We all think about the educational attainments that we want for all of our students and children. But also, there's as schools stay closed for longer, there's a risk of non-return. There's also the psychological and social well-being aspects of schools, as well as additional social supports such as access to nutrition and child welfare that schools provide. There's a larger benefit to society as being at school allows parents to be working. Next slide, please. And with that, I'll hand over to Yona.
Ioana, you're on mute, unfortunately.
Sorry, can you hear me now?
We can hear you well.
Yes, great. So we know that the local situation, the epidemiology, and the school resources, they vary greatly in different places within the country. So to facilitate each communities to make decisions on the adjustment of these school-related measures, we structured our thinking on a set of questions, and then we also proposed some best practices and recommendations. So when you will look at the WHO document, this is the structure that you will see in there, and this is the rationale why we took this approach. The first thing we considered was the local context and the epidemiology. So the questions that may guide an assessment in this regard span things like, what is the disease trend in that community? Are there officials in the community able to detect and respond to new cases? Is there a collaboration and coordination between the authorities and the school structures? What are the numbers and staff and children at risk for severe disease? Thinking of the underlying conditions, and of course, are there movement restrictions in place, and is safe transport available? And this is important because if there is no safe transport available, then this will guide very much the decision how to adjust school measures. Next slide, please. Another set of questions that we thought were important was about the school setting itself and the ability to ensure infection prevention and control measures. So some of the questions here might be linked to the policies, practices, and infrastructure available, then the behavioral aspects and the safety and security concerns. So on the first category, there are things like, are the instructions, the guidelines available for the teachers and the people that come to school to follow these recommendations? Are there enough resources such as enough alcohol rubs, soap, and clean water? Are there enough teachers themselves to ensure safe schooling? Are the teachers trained on these practices? Then the behavioral aspects are very much linked to this, and they've been thought of as having nudges in place to facilitate, to elicit the behavior change we want to see. So some of the things here might pertain to restructuring and adjusting the school environment. So reconfiguring some of the rooms where teaching is taking place. And of course, linked to behavior, there are the age considerations. And based on the local context, the culture in that place, and the educational objectives, certain age groups might be considered better suited to return physically to school, whereas others might be better off following teleschooling or other such distance learning approaches for the time being. Safety and security, as Shalini mentioned, the school has many benefits, and some children might depend on going to school to have a meal. Of course, then there's also the security concerns, and all these need to come together in this risk assessment and help guide the planning around ensuring that safety and security is taken into account. Next slide, please. So now we are moving into the recommendations, and I have to say about the graphics, I'm sorry, I'm a child of the 80s, so I apologize for my choices, but this is my universe. So when we think about the recommendation, these can be grouped into many domains. With the first one, which is probably not a surprise to a lot of people, it's the hygiene and environmental cleaning to limit exposure. So we see here Jerry frantically cleaning. We all need to wash our hands with soap and water as often as possible, and practice cough and respiratory hygiene. Disinfect surfaces, and this is linked to the wider surfaces, but also the ones that are more frequently touched, such as door handles or toys, desks, these sort of things. And in particular for gyms where contact and use of equipment might be often, there is a need to ensure that there is a more intense cleaning schedule. A second category is linked to the screening and management of sick students and teachers and other staff. Of course, the main approach should be if you feel sick, it doesn't matter whether teacher or the student, you should stay at home. And to facilitate this, there should be a waiving of the requirement to obtain a note from a doctor to certify this. We know that fever is one of the symptoms, so having daily checks of temperature might be a good approach. Then for persons that have been in contact with a COVID-19 case, it would be recommended for them to stay at home for 14 days and alert the public health authorities. And to help guide this decision of staying at home, schools might consider putting together a checklist to help teachers and parents make these decisions. Of course, all these reasons of what and why these measures are being done need to be explained to the teachers and the students. So communication is very important in this regard. And we must remember that children can get sick from other diseases, not just COVID. So it's important to maintain the immunization checks and to adjust these measures depending on the profile of the school. So if it's a boarding school, then maybe some hygiene considerations need to be applied to dormitories and other settings. Next slide, please. Another area pertains to physical distancing and teleschooling. So we see here Simba and Co, that they're quite close to each other. They should be at least 1 meter apart. And this should be maintained throughout the school, but also the desk spacing should be done based on that. Other things to be considered, stagger recesses, breaks and lunch breaks. The mixing of classes should be avoided. So instead of having children move around, it should be the teacher that moves around. There should be, these considerations should be applied to after school activities. So asking children to respect this physical distance. The document that we have provides a lot of examples how to achieve this. On teleschooling, we are seeing this implemented in a lot of places. Of course, there are settings where this cannot be implemented. And then we need to consider other measures, such as maybe broadcasting lessons on TV, on radio, and regardless of the method that is being considered, there should be appropriate follow-up and safeguards in place to ensure safety. We know that the internet can be a dangerous place sometimes, so provisions should be in place, including in this virtual environment. Next slide, please. Of course, whatever we do, we need to ensure monitoring of adjustment of these schools measures. We propose here a couple of domains. They pertain to effectiveness of the teleschooling interventions, because the ultimate aim of monitoring these things is to adjust them and to learn from the experience. Then looking at the effects on the educational objectives and the learning outcomes, but of course on health and the well-being of the children, the staff, and the people around them. and ultimately also monitor the trend in school dropped out that might happen after school closure. This is a major concern and unfortunately a reality in some cases. Next slide, please. So our concluding thoughts would be that we see success when an inclusive and early collaboration happens between the school and the community. And as Shalini mentioned, there are a lot of benefits to keeping the school open. Of course, we need to consider these in the context in which COVID unfolds. But there are things that we can put in place for the safe adjustment of these measures. And we provide here a link to the document. A lot of people have contributed to this. So there are a lot of people across WHO, but also our colleagues in UNICEF. So we hope you find this guidance useful. Thank you.
Thank you so much, Ioana and Shalini. We will, of course, be able to share the presentation after the call for people to access those links as well. I'd like to hand over now to Lisa, but just before I do, I'd like to say that we may have some time at the end for some Q&A. So please, if you do have a question, could you rather than use the chat function on Zoom, could you use the Q&A, because the chat is a little bit difficult to keep track of. So if you do have a question, we will try to address them at the end in the Q&A. Lisa, over to you. I've got your presentation, so let me get that up on the screen now.
Thank you so much. It's such a pleasure to be here with you all. Thank you for inviting me back for this important discussion. I know that this is an issue that's important to us from a professional level, but also personally relevant to many of us. So as noted, I will be focusing on what's already happening on the ground through UNICEF support to national governments. But I wanted to preface the discussion building off what's already been discussed around the many considerations that are necessary when we talk about school opening. School opening is not just about education, it's not just about literacy and numeracy. As noted, schools are an important place for children to develop socially, to oversee their emotional well-being, and many children require essential services that they can only get at school. That can be feeding, it may be specialized occupational therapies. And so the longer that schools close, the more we're denying children the opportunity to access these services, especially the most marginalized children. And we do know from studies that this does have a cumulative effects that can be quite long lasting in terms of health outcomes, as well as long-term socioeconomic outcomes. So the question of when and how to open schools as quickly as possible, but importantly, as safely as possible, is really, really an important one. So we'll move to the next slide, please. Just a brief reminder that in addition to the new annex that's come out, we do have school level guidance that the World Health Organization, IFRC, and UNICEF worked on together. The school level guidance is really addressing issues around supply and demand, and emphasizes the need for consultation and participation of children themselves and affected communities to ensure there's really the confidence to go back to school. And this is really building off the important lessons we learned from the Ebola crisis and the Zika crisis about sharing information and ensuring people are a part of the discussion and dialogue on how, when, and how most safely to open schools. So just wanted to remind you all of this particular guidance, and we can move to the next slide. The new annex that was developed also draws on this framework. Now the framework is a high level document, and this is meant to inform discussions with governments. The framework is really built around 6 dimensions: safe operations, learning, how we can better include marginalized children, how we can advance well-being and protection, and what are the financing and policy implications across all of these dimensions. This is really critical so that when we're engaging with policymakers and decision makers, both in the health sector, the education sector, and other sectors that are involved in children's well-being, that we have a comprehensive approach to addressing these issues. And so this is the way that I've presented some of the country examples that we'll be moving into. So we can move to the next slide. UNICEF has been tracking our country level engagement around education issues around the world. And what we see is that most countries have already begun thinking about how and when to open schools. These national responses are very focused on safe operations, but many of them are also looking at issues of health and well-being. Though at the time of this particular survey round, we were really focused on continuity of education. And I think the reason we're focused on continuity of education is because we understand that many long-term inequalities stem from inequitable access to education, quality education, and that the early years in particular are so important for critical foundational skills, the literacy and numeracy that allows further skill development. And this continuity of education is not only our responsibility, it's children's rights. And so this really is relevant to this ongoing discussion of safe school operations and school opening, because we do know that there's the possibility that once schools open, they may close again. And so having these policies and practices in place around remote education are critical to ensuring that continuity and letting parents and children know that the education will go on regardless of whether or not classroom instruction is available and if there are times when schools have to close. One thing we've really been emphasizing is that this is a very uncertain time, and that uncertainty creates a lot of anxiety for children and parents alike. So having a sense of control, having a sense of information, being able to expect somewhat and anticipate what's going to happen is really an excellent way to help families cope during these uncertain times. So we're really emphasizing the need to be planning ahead for continuity of education, and we're calling this sort of a blended approach to have these remote education options available as we continue with trying to open schools and understanding again that there may be cycles of opening and closing. We'll move to the next slide. So we've surveyed our country programs, and my presentation is really going to focus on low-income countries and some middle-income countries, because I think that the burden of preparation is a bit higher there, particularly in countries that have low resource settings, where we're worried about water provision, or we may have weaker health systems. And what we see is that most countries are really focused on opening schools and understand that this is a long-term process. And they're also engaged in a number of the aspects of opening schools. So if you look at the bottom right-hand corner of this slide, you can see where UNICEF is engaged in planning and engagement with the government, and where governments are noting priorities around reopening schools. And I think it's very interesting to see that risk communication and community engagement is so high. And again, I think this really speaks to what we've learned from the Zika and Ebola crisis, that we have to fight misinformation. We have to have the confidence of communities that schools can open safely, and to eliminate any confusion around opening dates or what the protocols are, what we're doing to protect teachers, what we're doing to protect vulnerable students. So this risk communication and community engagement is absolutely critical, and I don't think that we can emphasize that enough. And I know that WHO as well has really been put a lot of effort and time into this, and the excellent communication materials and groups that they coordinate have been a real asset to this larger community of practice. We can move to the next slide. So again, for the continuity of learning, we've already begun major investments throughout this national governments with education support where provided. And many are surprised to learn that TV is actually the main channel for alternative learning. And TV has quite a wide reach in many places, but we know that many of these modalities still are not reaching the most marginalized children. And so we're trying to emphasize that in addition to TV and radio and the online systems that we're all very familiar with, that there are other methods to support at-home learning. And this can be printed take-home resources, they can be self-guided self-study through textbooks. And so we're trying to work on rapid provision of printed materials. It can be check-ins through WhatsApp and text messages. And so again, as we think about opening schools, this is a really critical element for not only continuity of learning, but also this checking in. As was noted, when schools are closed, and when there are times of socioeconomic hardship, we do unfortunately see increases in violence against children. And so we do want teachers, who are often the ones that report violence in the home, to be checking with children as possible to ensure that we're maintaining those aspects of wellness and protection. Move to the next slide, please. So I wanted to give an excellent example of what's happening in UNICEF China. China is, of course, relevant to all of us, since this is where the outbreak started and where schools have been closed the longest and where the largest scale reopening has occurred. So what UNICEF has done in this context is they engaged in a really large-scale assessment. Because UNICEF China recognizes that there is relatively high connectivity in most areas of China, and most Chinese people do have access to phones. We felt that an online phone-based survey would be something that could receive a lot of participation, and we did see very large numbers of children themselves completing the survey, as well as caregivers. And what was really interesting is that the responses were across the board. There were parents who were concerned about their children being out of school and what the long-term academic and psychological consequences of that would be. There were children who were worried about their own performance and learning and miss their friends. And then there were also parents who worried that it was unsafe to send their children to school, that children would perhaps bring the infection into the home. There were children who were worried about infecting others, about keeping themselves safe. And so we saw that there was a wide range of anxieties that really needed to be issued. To be addressed, and that these were different for young children than they were to adolescents, were different amongst children, teachers, and amongst caregivers and parents. And so what UNICEF did was develop a communication package that really addressed these concerns. So this included both posters that can be put up in schools and public places, as well as videos that can be accessed via online mechanisms and social media, targeting these different groups with different kinds of messages, reassuring them about provisions that are taking place in China, reminding people of the protocols that are in place, and really trying to address these concerns, first and foremost, to normalize them, and to say that these are shared concerns across different populations, and then trying to give people a sense of what they could do to address them. So moving to just a couple of more examples on the next slide. So again, in almost every country, we see countries are beginning to really look at policies and protocols for safe reopening. And UNICEF's significant role is really working on contextualizing and localizing these policies, practices, and approaches. So from the financing perspective, our West Central Africa and East South Africa offices are working together on a costing tool that really will support low-income countries think about what the projected costing will be for supplies to help schools reopen in a way where we can manage hygiene and sanitation in a way that will help reduce transmission and help families feel safe and ensure that we're protecting the health of teachers and students. There's also been a stream of emergency financing that's been made available through the Global Partnership for Education, and Education Cannot Wait. And UNICEF is also joining forces with the World Bank for advocacy to protect education financing. We're concerned with the major economic downturn that education financing will take significant hits, but we know that this is a time to reinvest in education and help build back education systems stronger, so that we can use this crisis as an opportunity to address previous weaknesses by bringing in previously out-of-school children and really looking at ways that we can strengthen support to children. From the policy perspective, there's been just a lot of work done on collecting data, making sure that data is available, really having evidence-driven approaches, looking at coordination and bringing together different kinds of stakeholders so that we can ensure that, again, there's wide buy-in and we have wide-scale consultation. And also, again, looking at these contingency plans, understanding that schools may close and need to reopen, and that we need to have scenarios in place, financing and operations in place to address those changes in the situation. We'll move to the next slide. So from the safe operations perspective, UNICEF is really playing a significant role in bringing in sanitation materials, looking at water trucking, and kits for helping keep schools clean, also working on information around social distancing in the classroom and what that looks like. I think what's important to note is that even countries like Syria are preparing for school opening. UNICEF is a leading humanitarian actor, as are many organizations who are participating in this call, and we know how to deliver services safely even in the worst crises, conflict, in the aftermath of natural disasters. And so we want to continue to build on that learning to think about how we can apply those lessons to ensuring safe operation of schools in every context. Of course, there's a real significant emphasis on learning. We know that after even just regular summer breaks, we call it the summer slide, there are some losses in learning from children not being in school. And with this protracted closure of schools, we understand there'll be a real need for remedial classes, catch-up programs, and possibly accelerated education to help overage children or previously out-of-school children get back into school. So we want to be monitoring attendance and looking at what we can do to specifically target those most marginalized children who are out of school or who may have difficulty returning to school. One sad example from the West African Ebola crisis was the really increased rates of teen pregnancy and the increased rates of sexual violence against young girls. And so we want to look at, are there any things that we can do to support these girls to return to school? Reaching these marginalized populations is going to be critical. And we understand that children with disabilities, hard to reach ethnic minorities who may not be a part of the main language group, may not have the same access to information. So how can we be intentional about that from the beginning? And we already see excellent efforts happening in places like Vietnam and in Kenya. So we'll move to the last slide of the presentation. Nothing for me to say here other than I wanted to point out these resources because we will be making the presentations available to everyone. And so these are some of the resources that we talked about, both the annex as well as the 2 guides that I mentioned. And just to emphasize that we have the Global Education Cluster who's collecting materials from countries around the world related to education and COVID-19. And also the Interagency Network for Education in Emergencies has an excellent collection of COVID-19 education resources. So I'll leave it with that, and I'm looking forward to the Q&A session. Thank you.
Thank you so much, Lisa. I'm sure those resources will be valuable and used by all. So that's great to have. I'd like to now hand over to Julien. I will again share my screen. So over to you and welcome. Thank you for joining us on this call.
I'll try to share mine if that's okay with you.
That works well.
That's why I'm 2 times here, and I'm 2 times happy to be sharing with you what is happening here in the field in Switzerland, especially in the French-speaking part of Switzerland, where I am, the part that was most impacted by the COVID virus, as well as the Italian-speaking part of the country. And if you allow me, I'll make a short introduction on how Switzerland works, because it's maybe important for those who are listening that every decision in Switzerland is politically difficult because we have a lot of levels to work around. And I'll go through it real quickly. Switzerland is a federal country with the principle of subsidiarity, which means that we have, of course, our government, but the 26 states then have also their word to say and the things they have to do. So I am talking to you from the Canton de Vaud, which is one of the 26 states, one of the biggest, because it's 800,000 people. That's about 10% of Switzerland. And what I will tell you today is more or less the same in the other states of the French-speaking canton states, and also quite the same for the larger cities in Switzerland, like the capital, Bern, or even Zurich and Basel. The powers of the Confederation, so the main government in Switzerland, are set in the constitution, of course, foreign policy, customs, monetary matters, legislation, defense, all of that stuff. But then the states and canton, which I am working for, they have their own governments, their own parliament as well. And we have to manage budgets, political system, taxes as well. And in our case, also schools. Because the smallest political entity in Switzerland is the commune or the municipality. We have more than 2,000 of them in Switzerland, such a small country, and such large amounts of political parliaments and governments. But there are 315 my states. And they normally have their own responsibilities for schools, for energy supplies, for roads, for local planning, and so on. So you have to understand that everything that we are doing is according to our federal government, and then we have to work with the municipalities and the cities that are actually doing things for us with schools. So we have to have a lot of people around the table that are agreeing on what we do, and that's maybe one of the difficulties we have in Switzerland. Just a quick look at the situation here about COVID. It's from the Federal Office of Public Health. So the arrow is pointing at my state, Canton de Vaud, which is just close to Geneva, if some of you guys know Switzerland. We have around 650 confirmed cases per 100,000 citizens in the Canton de Vaud. It's not the worst in Switzerland, but it's one of the highest, second highest, I guess. The situation in Switzerland about COVID, the curve is flattening, and since April the 27th, our federal government is gradually easing measures and restrictions. What happens for us was the following. For reopening the schools, we actually closed our schools on March the 13th for the reasons that were explained earlier. I won't get over them right now. You heard already those explications, health explanations. On the 16th of April, the government announces his plan to allow schools to reopen again. So it's been like 1 month right now. But the decision was really confirmed on April the 29th. So we had approximately 10 to 12 days to organize everything to reopen the schools. On the 29th as well, the French-speaking states worked together hard to announce some common principles. And on the 30th of April, my state, Vaud, announced how we will reopen the schools. That's what I'm going to explain to you right now. And on the 11th, we reopened the school. It was just Monday. The Federal Office of Public Health had a few assessments and a few things that we looked upon, because they are the major authority for us on health and sanitary matters. So these are the principles that we were told. The children get sick much less often than adults. They have fewer symptoms. They play almost no role in the spread of the virus. And their ability to comply with the given measures increases with age. So that were the reasons why our federal government told us we could reopen our schools. It was the following assessments and postulates. But we had to fight a long way with other states along us to get some precise principles that we could apply in the schools, and we wanted them to be nationwide because we have a lot of specialities between the states in Switzerland. But in this matter, we wanted to have some common grounds to work on, because a lot of people are working in one state and living in another one. So if you don't have the same health rules, it seems a little strange and difficult to apply to them. So what we did with the other French-speaking states, we agreed on the following principles. The sanitary responsibility was the one from the federal government. We had to cope with it, but it was their responsibility. Reopening of the schools is welcome for all the good reasons that were mentioned by my other colleagues. The 1P to 8P children, that is age 5 to 12, will go back to class in small groups. That's what we did actually. And then the 12 to 16 will go back to class in small groups as well, but for a longer time period. And also some states wanted to continue distance learning for a little while. The reopening of the schools restores social ties. That's very important. And the reopening of the schools should also focus on consolidating achievements and on building not to disadvantage any students from this situation in terms of promotion, orientation, or certification. We worked hard for that. So what were the measures in our schools? We had three main principles. First priority was the health of the children, the teachers, and other professionals and their families, of course. And resuming also the pedagogical principles of school, because it's very important in the society to prevent anything from going wrong concerning equal opportunities for all. We did some adaptations to do some smaller groups. So the children from 5 to 12 are going to school from Monday, 1 day out of 2. So they went Monday and then today as a second day, half of the class. And it's the same for children from 12 to 16, but they will do that for 3 weeks, not only 2 weeks. The goal of that is not only sanitary, it's really to give time and a quality environment to the students and the teachers to set up the new rules and to learn how to work with them, and to let the teachers identify as well maybe the students that were most impacted by distance learning and that could be in the need of educational support or catch-up courses. I'll go quickly through the sanitary rules that we put in place. Wash one's hands upon arrival at school, on the return from every recess in the morning, in the afternoon, and if there are no sinks, hydroalcoholic solutions, but under the supervision of an adult. Social distancing, that was one of the main issues in Switzerland and one of the most discussed topic, because it was not really understood by the main population why in the schools we could go without social distance, because that was the decision of our Federal Office of Public Health. So no rule of spatial distance between children, but the distance of 2 meters maintained between children and adults, which is quite difficult in the smaller classes, and distance of 2 meters maintained between adults, cough and sneeze in a tissue or in the crook of the elbow, that you know already, of course. There was still a recommendation to limit physical contacts between children, do not shake hands, contactless breathing, do not kiss, hug, and favor games or physical activities without contact. To protect our training professionals and the school professionals, we set up a few things. We had a lot of talk with the unions as well. That was also a challenge. For example, transparent plastic panels installed at the counters of school offices, fitted workplaces in the teachers' meeting rooms. Masks are another issue in Switzerland. There's no general recommendation for wearing masks for the moment. Of course, people can wear masks and you can see masks in the streets, but it's not a rule to wear masks. You should wear them if you cannot stay at 2 meters. That's the position right now in Switzerland of our health public office. So you should maybe wear them in public transportation, but not if you can maintain this 2 meter distance. So masks in the schools are available for specific situations or on request from some teachers that wanted to wear them. The bins are emptied once a day and none is left without lid. Distribution of all documents only by students, not by teachers, and no food sharing, of course, between adults and children. During the recess, how do we work? For the smaller kids, we try to do the recess not at the same time for everyone. We alternately do it to avoid large groups. And for the older ones, we made some spatial distribution in the schoolyards with markings by groups or by class. And that is only to avoid mixing and to be able to track again if there's a new infection. It's not really for hygiene reasons or sanitary reasons. The parents, of course, have a role to play. They should avoid gathering around schools. At the end of the day, also students have to leave the yard immediately, which is not the case normally. Equipment and maintenance in classrooms and buildings. This was also a challenge for us because the state is managing the school and the teacher, but it is the commune, the municipalities, which are managing the buildings, and also the janitor or the cleaning personnel. So we really had to discuss a lot in 10 days with them. Disinfection is at least twice a day for the premises, surfaces, tables, door, window handles, staircase, toilets, and common appliance in the teachers' meeting rooms. Also, additional hand hygiene stations were installed in a lot of schools, because our schools are also sometimes not only in one building, but sometimes 10 or 12 buildings, or in small villages as well as big cities. School transport was also an issue, and it's not in our department, so also a lot of discussions, also a lot of rules to set up. It resumed on the 11th on Monday. The General Public Transportation Protection Plan was the subject at canton level. We did the same as we did for the classrooms. In dedicated school transport, the driver will systematically wear a protective mask, but in public transportation, if the social distance between children and adults cannot be applied, adults are strongly recommended to wear the mask, but this recommendation does not apply to children. In Switzerland, it's not recommended for them to wear a mask. A lot of them are still doing it. It's the parents' choice, of course. Schools, cafeterias, and restaurants is also a challenge. They're still open. They have specific hygiene rules. I will not go through all of them, but for example, self-service is prohibited. So we had to find some other means to serve the food. And we try for children from 12 years and up to have the same group as we have in schools, to avoid mixing again for the same reasons. The supervision of all those rules and measures are by school management first, and then by the prefects. This is an authority in Switzerland that is between the communes, municipalities, and the state, or by the office of the state's doctor. That's the main health authority for the state. He can be requested, and he can also provide help if needed on this supervision. Vulnerable students or professionals was also a big debate in Switzerland. Students who are vulnerable or considered in an at-risk category or living with vulnerable people, they were contacted by the schools. They had to fill forms, and they can continue distance learning, but only under medical advice. And maybe, and we hope, they can return to school possibly in the second stage or second phase under specific health measures. For school professionals, a decision is being drafted right now with the HR department, and after consultation with the unions, it's also a subject of many discussions in Switzerland. If symptoms appear at school, we made some rules as well. The student is walked out of the class, he receives a mask, he waits for his parents, or goes home depending on his age, of course. The parents contact the pediatrician or the state hotline, and for school professional, they walk out of the class as well, receives a mask, returns home, and contacts with her or his doctor at the state hotline. And it's also the health authority who decides if they're going to be a tracking or an inquiry about contact with this person. Just a few words on evaluation. It's not really the topic, but we made some decisions on the evaluation systems. Normal marks, the average of the first semester is compared to what the children had on March 13th, the day the class closed. If it's on their advantage, we'll take this average for the year. In all the borderline situations, the student succeeds in his year, and it's in situations of failure, we can also talk about an overall situation and the behavior since the reopening can be taken into account. We had to cancel a lot of examinations as well, and the school examinations, for example, that are replaced by the average of the year. What is the goals for us in this reopening of the schools? Of course, rebuild the social bond is very important. Promote equal opportunities for all, as it was already talked about in this webinar. Children in distance learning increases the differences in the families depending on the support that the children can get. We adapted the program as well, and we used this 7 weeks approximately in Switzerland before summer vacation to prepare for next year, next school year. It is very important for us. A few words about communication, because it was also a topic that was addressed in this webinar. To make the return to school less stressful and maybe to reduce anxiety about all these new ways of doing things, all these rules that the children must obey and the teachers must obey. And sometimes the child is maybe a little afraid and his parents are afraid and maybe the teacher is afraid to go back to school. So we really build on two communication tools. The first one is a video clip that is in French, and so it's not really useful for me but I can share it for other people if you want to. The other is maybe useful for other people. It's a game. It's a video game that we built in 10 days. It was quite a challenge. It's called coronaquest.game. The good thing for you listening around the world is that this game is already in 10 languages. It's in French, German, Italian, that are the national languages in Switzerland. But since we have a lot of foreign communities in Switzerland, we translated the game as well in English, in Spanish, in Portuguese, in Albanese, in Croatian, Serbian, and Bosnian, which are the most spoken languages in our region. And it has not a lot of text, so even if there are some interest of other countries, maybe translation could be implemented in the game. It was really a challenge, but I can maybe, if we have time, show you around a little bit of that game, because it's really to all the aim of the game is to know these rules and the things you have to do, but it really also to reduce anxiety and to talk about emotions that the kids can have and the support they can get in schools or with the school nurse or the school teacher, or talk to a friend that maybe is sad because there was someone in his family who died of the virus, or someone who lost his job. And so all this emotional communication is very important in the game. And you will let me know, Sarah, if I have 2 minutes, I'll show the game at the end of the presentation. I will just talk about the results. From Monday, we don't have a lot of time to really build some results, but I can tell you that the half classes are working really fine. Everyone is really enthusiastic about that, because children have time, teachers have time, parents are reassured. So that is working really nicely to have a reassuring atmosphere. We had no major problems to report on the 3 first days. We have 1 or 2% of parents that are refusing to send their children to school. There was a lot of media about that in Switzerland, a lot of talk and petition on social media as well. But the problem seems to be not so important, and we hope that through discussion and through this reassuring atmosphere, we can get most of those people to let their kids go back to school, because we think it's really important. Necessary equipment was available everywhere, but we still had a few problems for disinfection equipment, for example. They were in shortage in some school, and there are a lot of questions that are unresolved, such as the use of gymnasium, which are very hard to clean between 2 classes, for example. So we still have a lot of work to do, and right after this webinar, I'll be back at work to do that. So these are the few pictures that were taken Monday or Tuesday. You can see that we made some adjustments at the entries of the schools, and that the teachers were gathering their own students by class outside and then going with them up the stairs and into a classroom, and not all together. Washing station on the right, and you can see those half classes. That's the dream of every teacher and every student, of course, to be only 9, 10, 11 people in a class. But it's working fine, and we are really happy to have done this system. In other states, they also did one part in the morning, one part in the afternoon, for example. We chose 1 day out of 2 to reduce transportations. That is all for me. If I have 2 minutes, I'll show the game. If not, you can go for yourself, and I can also answer private questions about that.
Thank you so much, Julian. We'd love to see it if you have 2 minutes.
Okay,
that would be great.
I have 2 minutes. So
we'd like to answer a couple of the questions.
cool. I'll do it quickly. So I'll
we
just
have a large number of questions that came in, which you actually did end up answering in your presentation as we were going along. So
okay,
but
cool.
Carry on.
Okay, so this is the game. It's played on the web. It's of course free. It's coronaquests.game. It works also with .ch, but no one knows that .ch is the code for Switzerland. So we chose .game. So in the about section, there's a little explanation of how we do it and why we did this game. And I'll just show you maybe the deck of cards. If some of you guys are players, maybe you know the game Hearthstone, which is a major esport game with 100 million players around the world. And you play cards against each other. So you have to beat the virus, to beat the coronavirus. And you can use some characters as the nurse, the teacher, the parent in the first league. You can see that the actions are quite simple for the first league, which is for the small children. If the virus plays, these are the Evo viruses, and they can play fever, cough, fear, and you can answer with for fever, call the doctor. For cough, play the elbow. For fear, find help with your teacher on everything. And we, as the game goes on, the questions are maybe complexified a little bit. We have new characters, but we also have other problems like loneliness or massive spread of the virus. And Diamond League, which is not available yet, but will be available on Friday. We have more complex themes like loss of job or fake news or so on. And so you play, it's of course made for playing on the phone or tablet. And so you choose your cards, you put them on your deck, and you try to fight against the virus who plays along. For example, fear. Can I play something against fear? Yes, I can find help maybe. And so, yes, it was perfect. And now the corona plays, and you will lay down also cards and so on. And you can play some swords, and then the cards fight one another, and you can hope to win against the coronavirus. That's the game. It's quite simple, and we had a lot of success actually with the games in 2 days. Huge number for us is more than 20,000 visits, more than 120,000 games were played. So it works really fine. And yeah, that's another way of telling people what to do, and maybe to reduce anxiety around all these rules.
Thank you so much, Julian. Hugely appreciative of you sharing all this experience, and that can practically be applied by other countries. I think, as you allude to, the decision-making process is extremely complicated, and we issue guidance as WHO and UNICEF, but in your own context to apply that guidance and to come up with something that works for everybody is very complex. And I think there was a large number of comments in the comment box and in the Q&A saying that it's so valuable to learn from the practical implementation experience of others. So that's really wonderful. Thank you very much.
You're welcome.
So we do have a number of questions. I know we were meant to stop at 4 o'clock, so and I am aware that the time of our panelists is very precious. So I'd like to maybe just answer 2 or 3 questions, and I know that our risk communication team here at WHO is actually collating the questions in addition to the questions from the previous webinar that we held, and coming up with an FAQ that we hope to be able to put on the website hopefully within the next week or so. So that will be, whatever isn't answered today, we'll feed into that. So we had, I will rush on and address a couple of the questions before we end. But Julian, while we have you here, there were a number of questions about physical activity and how you manage that in schools. Are you doing indoor versus outdoor? I know you mentioned that it's difficult to clean gyms, but what were the decision-making processes around resuming sport?
We try to resume sport, as physical education is also very important. And we had really some amazing creativity around that area, because some of the sports teacher, they just adapted sports to the classroom, and so they came in the classrooms and they make some kind of urban training with using the pupils' desk, using whatever is in the classroom to do sports in the classroom. And so the pupils are not, they don't have to change, they don't have to use the showers and the locker rooms and so on. And that is mainly because we need a lot of human forces to clean everything between 2 sport classes. But we are working on opening some of the gymnasium, but it's really a school by school decision if they're open the gymnasium or not. And most of them are trying. It's heavily raining in Switzerland right now, but they are trying to do outdoor sports, of course, a lot. That's the main thing, and the others are using those classrooms to do it, or other classes that are easier to clean than a huge gymnasium between two groups of people. And yeah, we're trying to do it, but it's really it's a challenge.
Thank you. Would any of the other panelists like to comment on the concept of physical education and resumption of sports?
I will.
Carry on, Shalini.
Interestingly, our school did racket sports because, for example, for something like badminton, you have to have at least a meter distance. And so what they enforced was a 2-meter distance. And of course, as Julien mentioned, you know, that obviously requires that the weather is suitable. But I thought that was a good solution. They also were playing soccer, but they cut down the number of children on the field so that there was less contact between the kids.
Thanks, Shalini. There's been a number of questions in the chat about the use of masks in the classroom by teachers and pupils. I know in Switzerland it's not mandatory, but Rosamund, perhaps you'd like to make a few comments and then address the questions about the effectiveness of masks in the settings, the school setting.
Sure, thank you very much, Sarah. So indeed, this is an area where the science is still in the making in many respects. We have a lot more information on the use of, N95 masks for health workers for specific situations, or general medical surgical masks for the health sector, and patients who are already ill or coughing would also be wearing the mask. There's a lot less information on general use of masks and face coverings, and therefore it depends which lens you bring to the question. Are you bringing the lens of what's the science and what do we really know, versus the lens of what's the pragmatic public health approach, where what we're offering is a whole package, or what the world has at its disposal is a whole package, And then contextually in the local situation, you can best choose what works best for your circumstance and your situation, and that each one is a layer of protection, none of which on their own actually offers 100% protection against this coronavirus called COVID. Well, the virus is not called COVID-19, but the disease that results is called COVID-19. So it's a tricky situation, and I think different countries have therefore handled it differently. So our first advice really is to follow the local and national guidance, because we know that we have almost 100 countries online with us today. So we're not just speaking to a particular context. It's all of you have your own national take on it, and that's really important. That what gets across to the general public as well as teachers and students is a feeling of being able to protect themselves and having comfort and confidence in doing that. So having different messages and confusing messages is actually not helpful. So I think the first thing would be, what is your national authority guidance? And then what is the way that the children can be educated to, or trained and helped? The way that Julian has so clearly articulated the many psychosocial aspects of this question are as important in many respects, as the background science. I think that's the takeaway message for me. But also when we're talking about schools, we're not only talking about primary schools, although in secondary schools, we're also talking about pre-primary nursery schools, and we're also talking about universities and other post-secondary institutions. So keeping in mind that the guidance that WHO has put out this past weekend does not provide specific advice for each one of those circumstances, but that guidance can be adapted to all of those circumstances. So whether it's hygiene, physical distancing, use of masks, we don't touch on too much for the reasons I've just explained, but these are all things that can help local authorities decide how to proceed. I think another point that, just while I have the floor, Sarah, that we want to make is that we've talked a lot about closing schools and reopening schools. In reality, I think with some exceptions, but the vast majority of schools have done their utmost to remain open, to continue with distance learning or teleschooling or whatever you'd like to call it. And that you clearly articulated many of the strategies that if it's online, if it's television, if it's books, if it's printed resources, and this is the most important message, that not everybody can stay at home for a very long time, but where it's necessary, that this can be, the thinking is not close or open schools. The thinking is, how do we keep education, how do we sustain the educational effort and attain those educational goals in the best way possible given the circumstances. And the reason I raise this now, for example, so you might have to close a classroom if there's an outbreak in a classroom. That may not necessarily mean you have to close a school. But the reason I'm raising this now is that I think, for better or for worse, we have to accept, at least for now, that we're going to be with this virus for some time. And that what we're looking for is a real shift in behavior change for all of us. Whether it's the teacher who has to wear the mask in the classroom, or whether it's physical distancing in the sports yard, as you said, all these things are things that have to become second nature for all of us, because many local geographic areas may be having a little local outbreak or an imported case or a resurgence, and we're going to have to be very mindful of the local epidemiology of the disease in order to constantly shift and adapt what we're doing without causing confusion. So it's really important that we position this, as far as schools and educational institutions are concerned, is that we sustain the educational effort, and then we adjust those measures to ensure the safety and the health of everybody involved.
Thanks, Rosamond. I'd just like to address one last question, and perhaps Lisa, this is a question for you. There was a number of comments in the chat and on the Q&A about strategies to promote remote education in rural areas, and I think that came from some colleagues or participants in Africa. Lisa, is there anything that are you collecting some of these stories and strategies?
Absolutely. It's been really interesting. We've talked about, within every crisis is an opportunity, and we've long been looking for ways to
find financing interest for contingency plans and these kinds of alternative learning methods to broaden the reach of education. So I think a really interesting example has been in Sierra Leone, where during the Ebola crisis, there was wide-scale radio education programming, and that investment was then continued to manage ongoing teacher professional development. And then we were able to launch it immediately again with the outbreak of COVID-19. So we are trying to look at important lessons of remote education, but again, to diversify the ways in which we conceptualize remote education so that it's not just online learning, because we know there are limits to internet access, and we don't want to kind of increase the digital divide, but to look at these diverse methods that we can use. And there are a number of partners. We have an initiative called GIGA that's looking at expanding internet access. And so we're really engaging with private sector partners and you know, just kind of the proliferation of the e-learning partners that are out there to look at new ways we can find solutions for even the most remote communities.
Thank you so much, Lisa. We've also had some requests for a follow-up webinar because I think sharing of experiences is so appreciated. So potentially we can work with you going forward, Lisa, to get some other country examples on the line to further expand the series. So I think Julian has put the link in the chat for the game, because there were a lot of questions about that. But what we can also do is when we send out the recording and the slides afterwards, we will be able to include that link in that. I think we're going to end the webinar now. I'd just like to say thank you very much to everybody who's joined today for taking the time to come and share their knowledge and experience. Thank you to all the participants for joining as well. I'd like to just check to see if any of my colleagues or the other panelists would like to make a few closing comments. Jump in.
It was great to share, and if anyone has any questions, of course, you can make my email address available as well as the website, no problem. Thank you.
Be careful what you offer there, Julian.
Yeah, anyone can find it on the web, so I'm not offering much. So
okay.
Thanks,
Thank
everyone.
you so much, everybody, and I wish you a safe rest of the day.
Thank you.
Thanks, everyone.
Thank you, Sarah.
Bye.
Take care. Bye-bye.